It's Conduit News Radio with Paul Harrell.
All right, ladies and gentlemen, welcome back to the program. We've got a special treat for you on the line this morning. Please welcome to the program, we have Sally C. Pipes. She is the president and CEO of the Pacific Research Institute. Sally, welcome to Conduit News this morning.
Well, thank you so much for having me on.
Absolutely. Now, obviously, I know a lot of people have probably read your books out there. They probably saw you a couple of weeks ago on Mark Levin's show on Fox News, where you did an excellent job talking about the dangers of socialized medicine. But if there's people out there that don't know about your work, can you kind of tell us how you got started and why socialized medicine is a bad thing?
Right. Well, I'm originally Canadian. I grew up in Canada. All my family is still in Canada. And the government fully controls the healthcare system. Private coverage is totally outlawed in Canada for anything considered medically necessary. And so I've been working at the Fraser Institute as an economist, working, in the late 80s, we realized that waiting lists were starting to develop. And so we wanted to be able to monitor them and see what was happening. And so in the early 90s at Fraser, we published a document called Waiting Your Turn, A Guide to Waiting Lists, and it's published annually. And in Canada today, the average wait from seeing a primary care doctor to getting treatment by a specialist is 19.8 weeks. So that's almost 5 months. Back in 1993, it was only 9.3 weeks. Then in the fall of 1991, I got the opportunity to move to the States and to run the Pacific Research Institute based in San Francisco. Not exactly a bastion of free market ideas, but and then, of course, we had an initiative on the ballot for single payer in California, which I worked hard to defeat. And then we had Hillary Care, we've had Obamacare, and now Bernie Sanders, Bernie Care, Pramila Jayapal Care. So I'm fighting very hard to educate Americans on why this would be a disaster for their health if the government fully took over the system and banned all private coverage.
Is it something that once it takes hold, it's just like any other government program as well? Once people become accustomed to getting something for free, it's very difficult to take away, right?
Well, exactly. And Milton Friedman, my mentor, who wrote the foreword to my first book, the Nobel laureate, of course, in economics, he used to always say, find me a government program that has actually been eliminated. I think we found one or two, the Mohair Subsidy Act and maybe one or two others, but very, very difficult. Even when these programs are not working, people think something is free, and they just don't want it to be taken away from them. And so it's very much, a disaster. And, of course, it's not free. Bernie Sanders' latest Senate bill that came out in April, that he released in April, $32 to $38 trillion over 10 years. Canadians, of course, people here think their health care is free, but the average Canadian family pays $13,000 a year in hidden taxes for a program where they have to wait almost 5 months. 1 million Canadians are on a waiting list trying to get treatment. And, it's not free, and you have care is rationed and the long wait.
Wow, 13,000 in hidden taxes. This is interesting. So this is Conduit News Radio. We are an Arkansas-based, news program, and here in Arkansas, a couple years back, we expanded Medicaid under Obamacare, and we did it in a hybrid way. I say we, not me, the politicians,
the government.
And instead of just doing the traditional expansion, they decided to do a quote private option where they gave a bunch of money every month to Blue Cross Blue Shield in the form of insurance policy. So right now we're paying $600 a month per person for 250, 300,000 people, regardless of whether or not they go to the doctor a month, to, like a company like Blue Cross Blue Shield. And, to your point about, it not never going away, it doesn't matter how unsustainable, or it doesn't matter how many bad results that we're getting. We're kind of told, no, we need to, let's try to add work requirements now. Let's try to make the thing more conservative. And hidden taxes, they just got through raising taxes on a bunch, gasoline and sales taxes, and it's to pay for this, in my opinion. I don't think they want to admit it, but it's just kind of the way this whole process is playing out. And that's why I'm so grateful that there's a voice like yours, Sally, who's out there saying, no, we don't need to let them get the foot in the door. You mentioned Milton Friedman. Ronald Reagan also said they will use medicine to get their foot in the door to get socialism everywhere.
Right, exactly. And when you look at Senator Bernie Sanders, Alexandria Ocasio-Cortez, the new House member from New York, Pramila Jayapal, the House member from Washington State, her bill, which she released, is even more comprehensive than Senator Sanders' bill, because she wants her whole single-payer program to be implemented within 2 years. Bernie Sanders' plan is 4 years. But these plans are more comprehensive than Canada's because they add dental care, vision care, free drugs, free long-term care. The Canadian government can't even afford to add those. So if this happens in the States, as you say, we won't get rid of it. And by the time people realize they don't have access to a doctor, a lot of doctors will retire early. They already have under Obamacare, and the American Association of Medical Colleges has predicted by 2030 there will be a shortage of about 125,000 doctors in this country. And worse yet, I think the best and brightest kids are not going to go into medicine when they realize they would be civil servants, and salaries for docs will be paid 40% below what doctors get paid today for treating private patients, because Sanders et al. Want doctors to be paid Medicare rates. And so this is going to destroy the whole doctor-patient relationship.
Yeah, and there's this whole idea that if healthcare is a right, then we're born into this world enslaved to somebody else's, healthcare costs. And then in turn, you have the idea, a doctor is the best and brightest. Typically, they go to school, they put in the work, they put in the hour. I'm not entitled to the information in their heads. I'm not entitled for them to have to give me something for, quote, free to treat me. I mean, that's just, to me, I have a huge problem with that. But I don't think the average person, I don't know if they think that deeply, Sally, and that's an issue in and of itself.
Yeah, exactly. Well, I think that this whole idea of an entitlement society has been sort of brewing since Bernie Sanders was running against Hillary Clinton back in 2016, and he really wants America to be a society where everybody is beholden to the government. Mm-hmm. But as you know, government doesn't have any money. All the money that government has comes from us, the taxpayers, and it's not an efficient system. And America is an entrepreneurial country, and we want to keep it that way. If you want to, be beholden to government, well, move to Canada or move to the United Kingdom. The National Health Service, their version of single payer, is turning 71 this year. Long waits. There are, over 230,000 Brits are having to wait over 6 months to get an appointment. They're trying to buy doctors back from the European community because there's such a shortage of doctors. There's a shortage of 12,000 doctors in the UK. I mean, all of these things are just tantamount to what a single-payer government-run program will be, and it's not for America.
So you have I think a bi-weekly column over at Forbes, Piping Up. We're talking with Sally C. Pipes. I appreciate the pun there. So Piping Up, and your latest article, yes, Representative Ocasio-Cortez, the VA is badly broken. So the VA is a good example of what we wouldn't want, we wouldn't want that to be the standard for health care in America, right?
Well, I was debating Uwe Reinhardt, a professor of economics at Princeton, who unfortunately passed away about a year ago. But when I was doing this international debate, Professor Reinhardt interrupted me and said, I was talking about the perils of single payer, and he interrupted me and said, we have an example of a single payer system in this country. And I said, well, what is that, Uwe? And he said, the VA. Now, this is probably a year or two before all the terrible stories about the Veterans Administration and the long waiting lists and the lack of access to care actually started to come out. But Alexandria Ocasio-Cortez, her latest thing, in addition to supporting Bernie on Medicare for all, she now is supporting the idea of the VA for all. And she is saying, if it ain't broke, don't fix it. Well, a Democratic House member from Massachusetts, Mr. Seth Moulton, came out and said, I am a vet, and I am on the VA system, and it is not working for us. We do not want the VA system for all of America because it has fraud, it has waiting times, it has lack of access to the latest care, and a lot of vets have to drive many hours to get treatment, and as I say, they have to wait. So this is not a solution, and people need to just read the papers and listen to the radio to hear how our vets are so badly treated in terms of their health care.
I think you're exactly right, and I've heard from some vets that, from one administration to the next, there are some, veteran clinics that have improved, according to them, according to a veteran I know specifically, since President Trump has taken over. I think he's trying to do, the best he can, for our veterans. But it still is an example of how people can just get lost. They can fall between the cracks. And as far as the bureaucracy goes, it becomes, more about the existence of the bureaucracy itself and not the people that the bureaucracy exists to serve. And so that's a really, I'm really glad that you're bringing this issue up. Can you tell us about your latest book, Sally, and what you hope to accomplish with your latest book, the False Promise?
Yes, The False Promise of Single-Payer Healthcare was been published by Encounter Books. It's available on Amazon, and it's a small booklet which is designed to help American people understand what single-payer really is. The latest Kaiser poll showed that 56% of Americans like the idea of single-payer healthcare, and when you say healthcare should also be a right, that support goes up to 71%. But when you say to the American people, well, what is your support for it? If it means higher taxes and it means you'll lose your employer-based coverage, which 180 million Americans today have, and polling shows they like it, well, then the support goes down to 37%. People don't understand single-payer means all private coverage is banned. So I want people to know what it means for them and their health. I have a new book which will be out in January 2020. It's a larger book from Encounter called False Premise, False Promise, The Disastrous Realities of Single-Payer Healthcare. Because I have to educate Americans, because people like Bernie Sanders have the mainstream media in their pocket, and they have so many opportunities to say, hey, this will be free, everyone will have the best, and people buy into it without really looking behind the glass wall. So these are, my objectives are to educate people and explain what it would mean for them and their health.
Last question. Healthcare does continue to go up. I mean, that's one of the reasons the left says they have to get the government involved to make it free or more affordable or what have you. What are your thoughts on what could be done to put the free market more at work, or to lower prices to where we get the real price on some of this stuff?
Well, exactly. I mean, I have another book called The Cure for Obamacare. But really, the whole thing is that, during World War II, when wage and price controls were in, the government gave companies the right to offer health care to their employees, and employees get the right to get their health care tax-free. If you lose your health care and go into the individual market, you have to buy your health care with after-tax dollars. So I would like to see the playing field leveled so that individuals get that same opportunity. I actually think we shouldn't be getting our health care through our employers, but it's going to be very difficult to change that. But universal choice will lead to universal coverage. People should be able to, we need to expand the health savings account so that people can put that money away like they do now, tax-free, and they combine it with a high-deductible plan. But people should be able to put more money away just like they do in their IRA. People should be able to use the funding in their HSAs to help pay for their premiums. Seniors should be able to also have an HSA, which is not allowed right now. So that's a very important point. One of the other major reasons why healthcare is so costly in this country is because of the mandates. Now, under Obamacare, there are 10 essential health benefits, and then each state has about 40 to 45 mandates: in vitro fertilization, alcohol rehabilitation. All of these things add 20 to 50% to the cost of a premium. Now, I may want a healthcare plan that has alcohol rehabilitation, but you may not. You may not want one with in vitro fertilization. People should be able to get the kind of plan that suits the needs of themselves and their families. And right now, these mandates make it very, very expensive. And as we saw with Obamacare, the whole healthcare system in this country was overturned for, at a maximum, 12 million people, 83% of whom get a subsidy to buy coverage. But the take-up of the exchange plans is very, very low, and unfortunately, it has not led to universal coverage. And we need to have options so that people can get coverage, reducing mandates, health savings accounts. Tort reform is a big issue, too. It costs about $210 billion a year for doctors to practice defensive medicine because they are afraid of being sued.
Wow. Those are all great ideas. And I hope that, we can get some traction on them. I mean, I remember 12 years ago, Sally, my basic, of course, I was 12 years younger, but, I was $60 a month. I was, young and you can't even get
healthy.
that. Yeah, and healthy. You can't get that now anymore. If you're, a 22-year-old or something coming out of college, you can't get that price anymore. So.
No, because of all of these mandates. And that's why the young people paid that individual mandate penalty of 2.5% of income, or $695, because they didn't want to spend $400 to $500 a month on health care when they are invincible. So Obamacare was a disaster for the American people.
It really was. And I think any more government intervention, promising more and more is going to do the same thing. Sally C. Pipes, President and CEO of Pacific Research Institute, thank you so much for spending time with us this morning. And I'd love to do it again sometime. Thank you so much for the work that you're doing.
Oh, thank you so much. Take care.
All righty, you too.